Hello, everybody, and welcome. My name is Dr. Jane Simmonds, and I'm going to be leading on this next session. So I'm just going to start presenting my slides now. You can see in the background, I'm coming from London. I'm coming in the background here is the university where I work at University College London. Now, in this presentation, I'm going to be making this an interactive presentation, which means we're going to be using the Mentimeter. And the title of my presentation is Taking Control and Managing Your Symptoms. And of course, you've just been listening to Professor Leslie Ruswick, who's taken you through, giving you some really great insights into things that you can do to help yourself that are going to be helpful. And I'm going to take that on a little step further. So, as I said, my name's Jane Simmonds. I'm a physiotherapist. I think if I was in America, I'd be called a physical therapist. But in England and in Australia, where I'm originally from, we're physiotherapists. I'm the clinical physiotherapy lead at the London Hypermobility Unit, and I am an associate professor at the University College London, where I run a master's in paediatric physiotherapy. So we're going to start our interactions by you getting involved with the Menti. So I want you to go to menti.com. So you can go there by opening up another browser on your computer or by going on to your mobile phone or perhaps iPad and just typing in the code 5232-0149 to give us an idea where people are coming from and where you are now in the world. So lovely to see. I've got quite a lot coming from North America, from both the East Coast, the West Coast, and from Central. Quite a lot from Europe, so sort of many coming in from, I think, the UK, but it looks like we've got some coming in from more towards Northern Europe, Middle Europe. I think maybe that could be Germany, it could be Austria. We've got someone coming in from the Middle East, a couple from Australia. So from down in the southeast of Australia, someone from New Zealand, fantastic. Obviously loads of you coming in from North America, which I think we'd expect because of course we've got a host site there. But it's interesting to see where the clumps of people are. I wonder where our South American and African patients are. But as I said, we've got a couple coming from Australia, New Zealand, masses coming from America, but it looks like people perhaps down towards Mexico, quite a lot coming in from Europe. Someone coming from somewhere around India, not quite sure if that's Sri Lanka or perhaps a part of India, perhaps where they pop their dot. Interesting. So that's 163 coming in. I know there's a lot of people on the call. We've got something like 376. So anyway, that's great to see you coming in and logging in. We're going to be using Menti throughout the presentation. And gosh, goodness me. So thank you very much for those contributions. Oh, here we go. Here's South America now landing with us. Okay. Fantastic to see all those people coming forward. Okay, that's probably just over half of you who've logged in. I think we'll move on to the next slide now. And I want to ask you through the menti.com, which symptoms impact your life the most? So you've got some opportunities, I think, to put down up to 5 sort of words, a couple of words to make a word cloud here of which of the symptoms as a group I'm going to find out are impacting most on your life. Okay, so yeah, we've got the pain, the fatigue coming in, the brain fog, anxiety, headaches, yeah, acid reflux, POTS, missing activities, dizziness. Keep going, keep logging in those words. Goodness, look at that. The GI coming through, anxiety, pain, fatigue, brain fog, headache. The subluxations are there. I can see them. The insomnia, so the problems with sleep. Keep bringing them in. I want as many of you to contribute to this big word cloud as possible. So we really get a really good sort of picture of a group of what the problems are for all the people on the call, because we're going to be wanting to tackle these symptoms. So it's obviously the word cloud is still building, but probably as we would expect, pain and fatigue are two of the biggest symptoms which impact on people's lives. But it's very interesting to see here that the brain fog is a common one as well. Anxiety, insomnia, headache, that's been mentioned a few times. And headaches is coming up quite a bit there, the dizziness, but then there's all the other ones, the loss of work, being upright, mental illness, the gastrointestinal pain. There's lots of overlap here with these ones. So thank you. I'm going to stop when we get up to 200. We've got 193, and I'm going to move on at that point when we've got up to 200 logged in. But I think we can definitely see the themes running through here about those symptoms which impact the most, and they're the things that we really need to start trying to get on top of. Thank you very much. Okay, I'm going to keep on to the next slide now and just say that, you know, we recognise that when people develop symptoms, that they can come on at any time. Some people, they start from very early on in life and they sort of slide into them during their childhood and into their adolescence. And for other people, they've been well and then suddenly, you know, they have an injury or there's a big lifestyle change or some, you know, psychological trauma, physical trauma, or big change in lifestyle, and that's when their symptoms develop. But I want to get a little bit more, before I go into sort of talking about how we can help a bit more, I want to ask this question of you in terms of your understanding and managing your symptoms. So, yeah, really thinking about how much you agree or disagree with these statements. I understand the cause of my symptoms, I can manage my symptoms. And we're starting to see a theme here coming through with these interactions that we've got at the moment, that, you know, a lot of people have got quite a bit of understanding of the cause, not, you know, don't completely understand the cause, but actually when it comes to managing symptoms, you know, really in terms of that, they're sort of more towards the side of not really being able to cope, not being able to manage them. And now we've got something like 173. We'll get up to 200 here before I move on to the next bit. But, you know, this is very clear that, you know, while people start to have some understanding, actually what to do about it, how to manage, how to cope is obviously a real challenge. So that's really what this talk is about, understanding the cause of symptoms and then thinking about how can you take control. So the management approach that we teach and that we advocate to our colleagues now, and also to our patient group, because it's no longer a sort of us and them kind of approach now. We think about working together with people and having a very sort of joined up partnership approach. And what we've sort of produced in our guideline that we wrote in 2017, led by Professor Raoul Engelbert and a group of us working at an international group together, including Professor Rozek, was that we wanted to sort of say that actually it's about a holistic, compassionate and empowering approach to helping people with hypermobility spectrum disorders and Ehlers-Danlos syndromes. And empowerment means people having power and control over their own lives. This is about you being able to have control. It's not possible to empower someone else or to make someone empowered. Empowerment is about ways of working and supporting people. That means they can take control and responsibility for their lives. So it's really through education and sharing and partnership that someone can start to take control. It's not about what I do to you or what others do to you. It's about actually, in the end, how you can start to feel empowered to be able to help yourself. So the model of healthcare that we use is called the ACT approach. And this is something that was developed back in the 1990s, written about quite a lot. I put a reference there for anyone who wants to do a bit more reading, and there's been a lot more papers that have come out since then. But the idea here is that once you've got a diagnosis, or you've got some at least recognition of the symptoms, that there's a level of acceptance of having them. That's not giving in to them and giving up on them, on yourself. It's just recognizing that those symptoms are there. And actually, it's then about thinking, well, what needs to change? What do I need to do? What needs to change in my life, perhaps from the environmental perspective or from inside myself, in order for me to be able to take control and manage the symptoms, so that you move away from feeling as though your condition is controlling you to you being able to take control of your symptoms. And one way that you can think about this, and one way I asked, sorry, I asked my colleagues to think about this, is through a new tool that we have developed called the Spider. Some of you may have heard some of my presentations in the past. But this Spider tool is being validated at the moment, but we use it as an educational tool as well, so that we've recognized, and you've shown us in your fantastic word cloud, that pain, fatigue, symptoms around cardiac dysautonomia, gastrointestinal dysfunction, urogenital, mental health, anxiety, depression, and musculoskeletal instability, subluxation, spasms, and things like that, and headaches are all the main symptoms. So we've got these clustered into these 8 legs of the spider. And actually, we've developed a short questionnaire that will be able to identify these things to help direct the care. Now, when I'm working with patients, I'm also saying, well, you know, this is a teaching tool as well, recognizing that they might have all these different symptoms going on. Some people present more with more musculoskeletal problems, perhaps in pain and fatigue, okay, perhaps with some anxiety. Anxiety came up quite strongly in your word cloud. So that their pattern of presentation, if this was a gradient, if these arrows were going from 0 in the middle to 10 on the outside, that's that presentation. Another person might present with more broader symptoms, more systemic symptoms, and their sort of presentation may look like the green diagram. And then some people actually also have mast cell activation disorder, which isn't one of the legs of the spider, but the people who do have hypermobility spectrum disorders and hypermobile EDS, we know that a number of you do also have the mast cell activation disorder, which seems to kind of, if you like, emphasize many of these symptoms as well. It's like a sort of catalyst to the problem. So once we've got this, we sort of think to ourselves, okay, well, I know what these symptoms are. I've got some idea where some of them are coming from, but what am I going to do with them, and how can I start to get control? Well, the first thing I'd say is do have hope, okay? It's certainly over the years working with people, and I've been working with people with hypermobility spectrum disorders for about 30 years now, and I have seen people turn their lives around. And most of the time, all of the time, it's because they've managed to access perhaps the care that they need. They've read, they've worked on themselves, they've thought about the things that need to change, including some of the things that Professor Russett was talking about, and they've gradually been able to turn things around. And it means that it's a time for change. And I think, you know, that's the important thing to take from now, is that actually something about your life, if you're feeling your symptoms are out of control, it is a time to start thinking about what needs to change. Now, if we go back to the spider, and in this diagram, you can see rather than giving the symptoms, I've started to give what I think are some of the solutions. Some of these solutions are things that you've got a lot of control over because they're things that you can choose to do. So if we go from the top and start thinking about fatigue, then we know that things like pacing, good sleep routines, even drinking more, being, you know, having good vitamin D levels and graded exercise can all the things that can be helpful, okay, to helping with fatigue. So these things are all part of the management, some of which you can choose to do and you can seek to find out about. In terms of if you've got problems with cardiac dysautonomia, if you've got POTS or an orthostatic intolerance, then it's about, again, fluids, taking salt, getting access to information that's both on the EDS website or on the POTS UK website, breathing, as Professor Ruzick was talking about, graded exercise, often in a recumbent form, starting quite slowly. These are things that can help. Plus, there are other things like compression garments, also that can be helpful. And also there are medications which can be accessed as well in some situations. But there's a lot that can be done from your own perspective. With the gastrointestinal manifestations, again, diet plays a big role here. Particularly people have found things like the low FODMAPs diet's helpful. This is a safe diet for most people. You can easily access it on the internet, and it can take quite a lot of stress off the gastrointestinal system. Again, exercise can be helpful here. Some medications might be helpful, but again, breathing exercises are other ways which can also help with some of the gastrointestinal manifestations. If you've got urogenital problems, then we start to think about a women's health physiotherapy, which can be helpful, doing some pelvic floor exercises. And again, you can, particularly around the pelvic floor work, you can access a lot of that information on the internet now, learning how to do pelvic floor exercises. With anxiety and depression, I think obviously here you might want to be seeking the help of psychologists. Cognitive behaviour therapy can be helpful, hypnosis, but even at a basic level, just for your own thing itself and things that you can be doing yourself. Again, breathing are very, very important again to help sort of switch into the parasympathetic nervous system to try and wind down. But also the role of exercise has been documented over and over again for the treatment of anxiety and depression. So exercise, low grade, if you like, cardiovascular exercise, and that might be about just gentle walking. Any movement can be helpful here. So there are many reasons why exercise can help anxiety and depression. It can really help to drive some of those hormones. You might need some help to get you going, but bearing in mind that exercise and breathing are going to play a role here. And then thinking about the musculoskeletal problems, so the instability. We know that strengthening programs, proprioceptive exercises can be helpful. You're going to hear from Jeannie DeBon shortly, who's going to talk about the role of Pilates, which can be really great here. Thinking about some of the other things that Professor Ruzick talked about, around ergonomic adjustments, around posture, but also thinking about how to manage the pain. Then you can also think about other things that can help here, like accessing some pain education, which is available online, pacing, breathing again. So, and that of course, physical therapists can also help with these things. So you can see across the spider that there's things that you can do. There's also things that you can access. And if you've got the mast cell problems, then the low histamine diets, medication and breathing, all again can be helpful things to tackle that. So if you can tease those things out. So I'm going to say that making one small change can make a difference to your symptoms. Even making one small change around some of the things that Professor Ruzick talked about, around potentially improving your ergonomic, your sitting postures, around starting breathing, perhaps drinking some more, getting good sleep. So thinking about the things that you could do, even if it was just one thing, could start to give you some control over your symptoms and problems. So I'm going to finish this presentation by saying to you, given what we've just talked about, the talk that Professor Ruzick gave, the talk that I've just given around making a change, I want you to type into the Mentimeter, what one small change could you make that you think you could do that might start to make a difference? And we're starting to see some really nice ideas here, maybe accessing Pilates, some breathing, some pelvic floor therapy, trying to get better sleep, absolutely, working on the posture. So I can see breathing coming up quite a lot here. Learning about ACT, holding, account for yourself. So there's many of these coming through. I'm just rolling through here, breathing coming up. And it's a fantastic place to start with breathing. Something simple, even if you're in a lot of pain. Buying a shoulder relief, trying to go for a daily walk. Breathing, brilliant. Thinking about the diet, self-pacing, more self-care. Breathing coming up a lot here. And you know what? If you think about some of the most healthy people in the world, they're people who start with sort of meditation or breathing exercises. And the role of breathing has such an important part to play. Utilize that spider. Yeah, absolutely. Think about where you could use that. Get a new mattress, breathing, better sleep posture, increase the water intake. Absolutely. Proper exercise and sleep. So what I'd say to you is don't try to take on too much. Just think about trying to start on one thing that you think you might be able to do. But fantastic to see all these people. So we're really, get a new chair, get a new desk set up, maybe start the pelvic floor, advocate for yourself, and be kind to yourself, absolutely. Download the app and remind to check on posture. Yeah, that's a good one. Better orthotics. Breathing, less junk food. Yeah, I could do with that. Working on posture. Okay, Pilates, self-pacing, lovely. Try the low histamine diet. Yeah. Okay, so prioritize myself and advocate, absolutely, and put breathing at the top, moving each hour, decreasing alcohol. Look, this is like a New Year's resolution, isn't it? All of these wonderful ideas that people are coming up with. Find a therapist, absolutely, reach out. Control the mental health. So really start to think how you might tackle that. Honestly, I don't know. I can't get my insurance to cover anything. Okay, I get that. But it may not be that the insurance can cover it, but maybe just starting with something like some breathing. Okay, so breathing work, just something small that you could start to think about. Okay, so lots of ideas, more than 200 people coming in and giving their input here. So look, I'm going to just come out of this presentation if I can. I'm going to stop sharing. I'm going to come back to the group and just say to you all, look, thank you very much for listening to the presentation. I'm really hoping that really, got you thinking about, listening to Professor Ruzik's presentation, listening to this presentation and interacting like that. Actually, you've started to think about just one thing that you could take control of. So thank you really very much for listening. It's been lovely talking to you all. I know there's almost 400 people at the other end of this presentation. And I'm really hoping that you've got something from our presentations. You're going to be hearing from Ginny DeBon shortly. And then there's going to be an opportunity for people to ask some questions as well. So I'm going to, I think, finish up there, if that's all right. I think our admin team can help me out on this one, and that would be great. So, so as I said, I think the thing to really focus on in terms of how you take control is to think back through that spider diagram and to think about which bit of that could you do. So if you're someone that's really struggling with fatigue, then actually starting to think, well, where's the fatigue coming from? You might not have all of the answers to that, but certainly we do know that with fatigue, that pacing is very important. So trying not to do everything just on one day of the week, but spreading the activity around, but also recognizing that you need to optimize your nutrition, optimize your water intake, make sure you've got good vitamin D levels, and also think about some graded exercise because there's good evidence of that. And I think the other point is around getting some pain education. If pain is such a big problem, that actually there are ways of managing pain and there are ways to ultimately access. And some of them can be self-directed as well as the help that you can get from others for those things. So I hope you found that a useful and helpful presentation. And we're going to look forward to talking to you in our group session. And I'm going to, I think, sign off now.